To make a good impression.
Yeah, I noticed that a little while back. Okay, so we just straighten that out to relax. So there's adductor longus, right? You can't tell the difference
Longus
between
first.
pectineus brevis, magnus, and gracilis is very difficult to palpate. It's very difficult to find.
Feels tender though.
So I'm going to go straight into longus.
Longus.
So perpendicular.
Yeah.
And as you guys know, longus is the most commonly injured adductor muscle.
Is that 40 you're using?
That's a 30.
30.
Going easy on her.
Yes, please.
So the pulse is here. Doof, doof. So if she's painful there or there, in pectineus or brevis, I'm going to needle in a medial direction, away from the pulse, like that.
Medial direction, away from pulse.
Yeah, for pectineus and brevis. My needle into longus is going perpendicular and straight in because I'm already 2 inches medial to the pulse, and longus is superficial. This pulse, while it's superficial over here, as it goes down the thigh, here, it's now pretty deep, probably 4 or 5 inches deep, and it's going through the adductor canal into the posterior thigh. I've changed now to a 40 ml needle. I'm still going to be needling either, most probably brevis. I'm going in a medial direction.
What are you needling, sorry?
Adductor brevis.
Rose.
I think. By virtue of where my needle is and the
So
anatomy.
is it kind of acceptable from a clinical point of view, if you've palpated someone's adductors
Yeah,
and you found some trigger points,
yeah.
not to necessarily identify the individual muscles, but just say,
You're in the.
that's
yeah.
what I'm doing.
You can't identify the individual
No.
muscles. However, if the patient's tenderness is here, you're thinking to yourself, "Oh, this is probably pectineus or brevis." If the patient's tenderness is here, this is longus. Absolutely 100% longus. If their tenderness is underneath here, so when they needle my groin here, my tenderness and my pain in my groin is predominantly longus, but I also get it when I kind of palpate here into magnus.
Yeah.
It's also really, really sore. We're going to keep the 40 and we're going to ditch the 30s. Thank you. So now I'm going to do magnus, right? I can needle magnus either by going through longus, that's going to make it just doubly uncomfortable, or I can slide medial to longus and needle magnus in this direction. So now I'm missing longus,
And you're going perpendicular.
I'm going perpendicular
Okay.
and lateral, in a lateral direction,
Lateral, and this is Magnus.
a lateral away from the midline,
Yeah.
perpendicular to the skin into longus, below, into magnus, below longus,
With a 40.
with a 40.
It feels like we're still in there, doesn't it?